Chest pain strikes. Your first thought is always the same. Is this a heart attack? The choice you make next is critical. But for women, there's a hidden danger. They have over a 50% higher chance of being misdiagnosed during a heart attack. That initial wrong diagnosis can more than double their risk of dying within a year. This isn't just about gender. Anyone who misunderstands their symptoms risks delaying care, causing permanent heart damage. We will give you the clear signals for when to go to urgent care versus when to call 911. Knowing the difference could save a life. So you have chest pain, but it doesn't feel like a Hollywood heart attack. Can you go to urgent care? Urgent care centers are equipped for an initial evaluation. They can check your heart rate, blood pressure, and perform basic tests like an EKG or a chest X-ray. But here is the most important fact. Urgent care cannot definitively rule out a heart attack. They simply don't have the tools for a full diagnosis. An emergency room is fundamentally different. They have advanced imaging like CT scans and provide immediate access to on-call specialists like cardiologists. You might think, but my EKG at urgent care was normal. A normal EKG does not rule out a heart attack. Some cardiac events require advanced ER monitoring. So why is this distinction between the ER and urgent care so vital? It comes down to a simple, powerful phrase that doctors use. That phrase is, time is muscle. Every minute you delay proper treatment for a heart attack, more of your heart muscle dies. Permanently. So what are the unmistakable signs? First, severe or crushing chest pain. Pain that radiates to your arms, back, neck, jaw, or shoulders demands an immediate 911 call. Second, look for a cluster of symptoms. Chest pain combined with shortness of breath, sweating, nausea, or dizziness requires an ER visit. The most dangerous thing you can do is self-diagnose. Dismissing these signs as just indigestion or anxiety is a gamble you cannot afford to lose. But here is where it gets truly confusing. Many things can cause chest pain that have nothing at all to do with your heart. These are the great mimics: acid reflux, muscle strain, panic attacks. Some are harmless, but others are just as deadly. How can you know the difference? Consider musculoskeletal pain. Did you just lift something heavy? Is the pain sharp and worse when you press on it? This is less likely to be your heart. But now for the deadly mimics you need to recognize. These are not cases for urgent care. They are 911 emergencies. First, a pulmonary embolism. This is a blood clot in your lungs. It causes sharp chest pain, sudden shortness of breath, and rapid breathing. It can be fatal. Second, an aortic dissection. This is a tear in your body's main artery. This is a surgical emergency. These mimics prove you can't self-diagnose. But there's one more layer of complexity we must address. It brings us back to where we started. Recall that shocking statistic? That women are over 50% more likely to be misdiagnosed? It happens because their symptoms are often completely different. Women may not have crushing chest pain. Instead, they might feel unusual fatigue, nausea, or indigestion. Pain can be in the jaw, neck, or upper back. Even more shocking, almost a third of all heart attack patients experience no chest pain at all. This is far more common in women, making diagnosis harder. Because these symptoms are dismissed as anxiety or stress, women get sent home. This delay in diagnosis is why their one-year mortality rate can more than double. We've covered ER capabilities, deadly mimics, and atypical symptoms. Let's connect these pieces to create a simple, life-saving decision framework. This is why the ER's advanced tools are so vital. The subtle symptoms women experience might only be caught by the advanced blood tests and monitoring in an ER. Remember, time is muscle? Whether it's classic symptoms, a deadly mimic, or atypical signs, the danger is the same. Delaying definitive care costs you heart muscle or your life. The central truth is this: the risk of undertreating a heart attack is infinitely greater than the inconvenience of a false alarm at the ER. The ER is the safest default action. So, does this mean you should never go to urgent care for chest pain? No. There are very specific low-risk scenarios where it's an appropriate choice. Urgent care is an option if the pain is mild, you're under 40 with no heart disease risk factors, and the pain is clearly from a muscle strain or known acid reflux. Your ER Go list is crushing or radiating pain, pain with sweating, nausea, or shortness of breath, any ripping sensation, for women, unexplained fatigue or jaw pain. But the single most important rule is the simplest. If you are worried enough about your chest pain to be watching this video, you need to be evaluated in an emergency room. Don't gamble with your heart. Don't try to be your own doctor. Knowing when to call 911 isn't being paranoid, it's being prepared. Share this video and help save a life.